did you lose so much weight out there? What's happening? And I was like, why? And they're like, your face is tiny. It's so tight. And I was like, you guys, I did 12,000 things out there. Like, I'm sure it's paying off now at this point. When I went to Korea recently, just a few months ago, I was out there, and you know that there's so much beauty tourism out that way. And I was like,
I feel like you really did Korea the right way. You went in and you were like, this is everything I'm going to get done while I'm here. And you also studied while you were there too.
Absolutely. So I was with 2 facial plastic surgeons learning, you know, Asian style neuromodulator, Botox placement, and also Asian style threads and Korean style filler and facial balancing and all of that kind of stuff.
And do you agree that they are much further ahead than we are?
Oh, 1,000%.
How many years ahead? Like 5 years, 10 years?
I think they're always 10 to 15 years ahead of us.
Wow.
So even with microneedling.
Let's really think about that.
Yeah.
10 to 15 years ahead of us in aesthetics, in skincare. We know that the sunscreen is like superior, but in facial treatments, you think that they're that far ahead?
Yes. And I know this because even when microneedling first came out here in the US, it had already been popular in Korea for 13 years before us.
Wow.
So it's like, you know, we're held back with ingredients, we're held back with procedures. And some of that is really great because we have regulations that keep us super, super, super safe. And then some of it holds us back from a lot of really great stuff. So in Korea, I had a talk with Dr. Hanjin Kwan, who I had a training with, and he is the CEO of Ultracol, which is like a very, very popular and wildly impactful biostimulator out that way. And he actually did my hands with it, by the way, when I was out there.
And can you explain what a biostimulator is?
Yeah, so a biostimulator is a treatment, usually an injectable, but it can be a device as well, that is causing your body to do what it does best and heal and regenerate itself when it has a little boost of something. So it can be an injectable. So a biostimulator injectable can be like PRFM or Sculptra. It can be through microneedling. So microneedling is creating, you know, controlled, gentle micro channels, which essentially are controlled injuries to the skin and trauma. And your skin wants to regenerate collagen and elasticity and all of that. So he's the CEO of a new biostimulator out there. And he also is very well known and respected for the thread work that he does. And so I was asking him, what is it? What's happening out here? Why are you guys so advanced? And why do you guys like to do so many things at once? And how do you guys come up with all of this stuff? Like what's going on out here? And he was like, Vanessa, we have just within this one block, 50 plastic surgeons who are doing everything that I do. And I was in Gangnam, which is like their, you know, Beverly Hills, and everyone gets surgery there. And he was like, and this is just one block. And so you have to be incredibly, incredibly impactful, efficient, and you have to show with one treatment how insanely different you are as a plastic surgeon, how good you can make someone look with just one visit. And if not, you failed, you're not going to have a great career. Like, you just won't be busy.
The competition breeds excellence.
Absolutely. And so I was like, that's fascinating. And then after my studies with the 2 surgeons, so it was about 5 days, we did hands-on and we were also doing didactic. I was like, I'm going to go do some stuff. Let's get some stuff. What's out here? And I had been researching for quite a while also because I knew I had this trip coming up, what to get done. My skin struggle has always been hyperpigmentation. I also have rosacea. And as a brown woman, that looks different for my skin. It almost looks like allergic reactions are happening. And so I've been, you know, in talks with dermatologists for years and years, and no one could figure it out. And then actually one of my friends who's a woman of color goes, you just have rosacea. And I was like, what do you mean? And she was like, yeah, I have it too. And I was like, no, I don't know. And it just looks so differently in our skin. And with rosacea, you're getting these kind of like mini rashes that are happening on the surface of the cheeks is what it looks like. And those mini rashes are bringing so much vascularity to the surface that it turns into hyperpigmentation.
Wow.
Where for someone who is Fitzpatrick skin types 1 through 3, like very fair skin and white skin with pink undertone, they don't go into the brown. It stays pink and then it fades. And for me, it's constantly hyperpigmentation. And so when I was out there, I was like, at 3 different clinics, what do you guys suggest? And all of them said Picosure. One of them said, if Picosure is too expensive for you.
And how much is Picosure?
By the way, Picosure out there is like $150. Here in the US, it's like $950 to $1,400 I've seen at some clinics, which is insane.
So there's a huge price difference in these treatments in Korea. Okay.
Huge. So they were like, you could do the Picosure. It is the best, and you'll see most results from one treatment. Or we have other cheaper Picos, which are, Pico is a name of the laser wavelength. So we have other Picos that are cheaper. You just have to do more treatments and it's fine. So it's your choice, whatever one. And I was like, well, I want to do the best and I'm not coming out here all the time. So give me that Picosure. And it was so wonderful of a treatment. I saw my skin clearing up as far as the like brown spots and like some of the scarring and some of that deep pigmentation that I had actually gotten when I was younger and used to be really naughty and not wear sunscreen and just be out in Hawaii, out at the beach, in Newport. And I saw that clear up beautifully after one treatment. And I was like, this is fantastic. Okay. And so I came back 3 weeks later, we bought it and now we have it in our location at the things we do.
Oh my gosh. Okay. So I know what I'm booking when I come to see you.
I can't wait to treat you. You had Erica Chidi on.
Yes.
Erica just came in for it. She's posting about it because she was like, I had no idea how safe this was going to be for my skin.
Yes.
I'm telling everyone. And I was like, oh my God, thank you. This is amazing.
No, please tell me all the treatments you did in Korea.
Oh my gosh. Okay, get ready for the laundry
and
list.
why biostimulator in your hand?
Okay, so truthfully, this biostimulator in the hand happened because we needed a model in the training class.
Okay.
And
so you volunteered.
He was like, so this biostimulator called Ultracol, we can place it in the under eyes, we can place it in the face, we're going to place it on the jawline. And so we watched him do that. And he was like, oh, I really want to show you guys in the hands too. And he was like, where's the model for the hands? And the assistant was like, we don't have one. And he was like, Vanessa, how about you? And I was like, how do you know that I'm down for everything, doc? And so, I was like, yeah, let's do it. And so he placed the Ultracol and he placed one vial in each hand. And there was some numbing placed in before and it took about 10, 15 minutes. It was totally fine. The interesting thing is he was like, you have to go to the pharmacy afterwards and this is your prescription. Just bring this to them. Take those medications for sure. And I was like, what's in here? And he was like, stuff that's going to make sure that you don't have like extreme swelling. And I was like, what's really in here? And I had my Papagao. It's a little app that's like a translator. So I had my Papagao app, like read it and everything. And it was antiplatelets, antibiotics, and also something for pain. And so I was like, antiplatelets, that's really interesting because we don't do that in the US after treatments. And I was like, wonder what happens when you don't take it. So I didn't take it. The next day, my hands blew up. I was supposed to do threads. That was our next training day was threads. I was like, there's no way. I can't even I had Kirby hands, like they were just like little pink. Anyways, and so I was like, I should have taken that medication. He was like, you didn't take the meds, did you? And I was like, no. And he was like, take them tonight. And it was fantastic. Everything went down. It was totally worth it. But now I had it done back in March. The back of my hands were quite sinewy.
Right. Hands are the first sign of aging, right?
One of the first signs, yes. But it's definitely a telling sign. So usually with hands, it starts to look like the youthful fullness in the back of the hand starts to fade, and you can see the tendons and the muscles and the bones start to really poke out. And that's something that I'm particularly not concerned about usually, but when he was like, does anyone want to do this? Now that the results have set in, I'm like, oh wow, that's actually really nice. These are my 28-year-old hands, that's, I didn't even know that that's something that, we could actually really do and improve. So I'm really happy that I did it actually. And the results will last years and years. So I will be losing collagen 4 to 8% annually, all throughout my,
and that happens
my skin and body.
After the age of 25, you lose collagen every year? Or?
So after the age of 25, your collagen production starts to slow down. Then closer towards your 30s, you start losing 4 to 8% every year, which if we're at the max side of things, if we're at 8%, even 8 to 10%, because we've been baking out in whatever sun, because I hear my patients say, oh, I don't see what the problem was. I wasn't laying out. The sun doesn't care if you're moving or if you're still, you're out in that sun.
I know.
It's getting you. So, so then in your 30s is when we start losing the collagen. The collagen production in your 20s starts slowing down, and then the production is stopping at a certain point and it's starting to reduce. So I was all about that hand treatment. And then as far as my face, I visited 2 different clinics for my face. One of them was like this very chic, known for like Naomi Campbell goes here. It's so hard to get an appointment. People were messaging me like, how did you get an appointment? Like, this is so crazy. Like, even like the richest housewives in Korea have a hard time getting in with this doctor. And I was like, I honestly just messaged her on WhatsApp. I don't know what the exclusivity is. I don't know. Maybe it was a slow week for her. I ended up seeing her and she did a very extensive skin analysis in the beginning. So we did a skin analysis moment where she was going over all the different sunspots that I have, all the different like sunspots that I'm going to get in the next 5 years that are going to come to the surface, which that really scared me. And I was like, oh my God, I thought that I had it under control, which led me to the laser treatments. And then she showed me the lines on my face and she was like, so all of the lines were highlighted, all the little wrinkles. And
oh my God. See, this would like mentally be a lot for me to
handle.
Oh,
I was fascinated. I was like, give it to me, give me all of the things, give me my report card. And she was like, have you been doing things? And I was like, we had a translator with us too. Okay. And so I was like, yes, I do a lot of things to my face. And she was like, your skin looks really good, especially for your age. We're clocking you at about 3 to 4 years younger. Okay. And I was like, thank God all this poking is going to, you know what I mean? Has been like, it's coming to fruition. I was like, fantastic. And she was like, really, let's do some microneedling. Let's do a little bit of like stem cell microneedling for you. Let's do one Thera, which is like a baby oil therapy because we don't want to minimize any of the fullness in your face, but let's tighten you up a little bit. Let's do about 45 minutes of microcurrent. I've never had so much microcurrent in my life. Afterwards, my hair was like, zzz, like it was insane the amount of microcurrent that they gave me. So the treatment wasn't done by the dermatologist. It was done by a nurse afterwards. And I was like, that's an interesting way of doing things, because typically what we see is the doctor does the treatments and then you have like a skincare consultant start the right. Consultation, and then the doctor comes in afterwards. So it was opposite. And then I went to a different clinic and I was like, okay, let's see what this experience is going to give me. And I wanted to see if their suggestions would match up. They didn't do a full skin analysis. So I sat down with a skincare advisor or like a beauty advisor. And she was like, so what do you want to do? And I was like, well, what do you think I should do? Right? Like I really wanted the guidance. Right. And she was like, okay, let me look at you. And she was writing notes down, typing. And she was like, hyperpigmentation, let's tighten the face. Let's do some injections. And I was like, what kind of injections? And by the way, I'm not saying what I do. I haven't sent these, this office, my social media. They have no idea. I'm paying for all of this like out of my own pocket. And so she was like, we can do Botox for you. We can do filler. We can do some biostimulators. And I was like, where would they go? And she was like, I don't know. You have to talk to the doctor about it. And I was like, okay, this is really interesting. I'm not going to do any of those things because I'm scared of getting injected overseas. I just want to be close to a physician or an injector after. And I was like, tell me about the biostimulators though. And she was like, oh yeah, like we have stem cells. And I was like, oh, that's fascinating. I wanted to do the stem cell procedure where they take the stem cells and then they do an IV and they can also inject it. I just didn't have, I wanted to stick around longer. So I was going to be leaving in a couple of days. And just in case there was complications, I wanted the possibility to stick around. So I didn't opt in doing that treatment. However, I did all the other treatments. So we did something called Onda actually the Onda wasn't on my face. I asked about the back of my arms. Okay, so we did Onda on the back of my arms, which is a really strong skin tightening and fat dissolving treatment that they told me you can only do this once or twice a year. You cannot do it more than that because it takes so much fat. And I was like, I think I can handle it. Let's go for it. After one treatment, I was like, oh my God, something actually happened. Because, you see these machines that are going on the back of the arms with the gel and you're like, is anything really happening? There's always an immediate effect afterwards where there's a degree of tightening because some massage has happened. But the Onda was amazing. It's from Italy. It's not approved here in the US. I don't know if we'll get it because it's so powerful. And the FDA is really tough with that kind of stuff, but it was fantastic. And then they did Picosure laser to my face and my neck is what they suggested, which is really interesting because usually in the US, we're only suggesting things to the face. So they didn't forget my neck, which was fantastic. They did titanium tightening for me. It's from Alma Lasers, which we do have Alma Lasers in the US, but we don't have the titanium tightening for some reason. So that was to tighten the lower face and also my jawline. And so we did all of those treatments within one sitting. And it took about 2 hours. And I was like, okay, we'll see what happens. When I got back, I think I was like, okay, a little bit swollen. There's a little bit of puffiness, but it doesn't really look like I did all of these different procedures. A couple weeks later, people on my staff were like, did you lose so much weight out there? What's happening? And I was like, why? And they're like, your face is tiny. It's so tight. And I was like, you guys, I did 12,000 things out there. Like, I'm sure it's paying off now at this point. So that's my journey in Korea.
I love it.
I did some studying.
I feel like people are going to listen to this and want to go to Korea to get things done. What would be like your top piece of advice for assessing where to, I mean, it's like, obviously there's just so much in Seoul, like how to figure out where to go, what to budget for. Where do people start?
Yeah, so there are a few different tiers of clinics. There's like these, they call them factory clinics, where it's...
That sounds bad.
It sounds bad. It is bad. Okay. I think for women who are a little bit more mature and looking for like a luxury, very legit, complete science procedure, it's probably our worst nightmare.
Okay.
So it's where you can, you walk in and there's tons of people and everything's super, super cheap and they're stacking everything possible, whether it's for you or not.
We're avoiding those.
Avoiding those at all costs. And I see a lot of influencers on social media who are really young going to those because of budget. And that's where things get really tricky. And then there are clinics that are more popular, but are more expensive because you are getting so much more attention to detail. All of the, doctors there are plastic surgeons and dermatologists there. It's very private. And then there are very, very private exclusive clinics where a lot of these like K-pop celebrities go to, Korean actors and actresses, where it's the doctor doing the consultation. They're going to do all of your procedure. They lay out what the rest of the year is like for you because you have to come in multiple times for all of these different things. So I would say starting off at the mid-tier clinic is great. I think making sure that you're in touch with them and see how they schedule you and how they respond to your questions, and if they offer a translator or if you need a translator is really important. If they have, these professionals who are doing the consultations, if you're going deep into very particular things that you need, you probably want to go to a clinic where it's the doctor doing, the actual consultation. So that's where there's so many of them, you guys. So that I ended up going to Lianjiang is one of the clinics that I went to, and I also went to Evercell. I liked my result from Lianjiang more than Evercell, and that's where the doctors were doing the treatments, and they were more impactful and more efficient within one treatment for sure.
Would you mind sharing how much you spent on
absolutely.
everything you did?
So at Evercell, I ended up getting the microneedling with the stem cell, and then they did that baby Ulthera treatment, and then they did the microcurrent forever. And that, and they also did one other thing. I believe it was like an LDM treatment, which is like, hydrating ultrasonic. And that entire treatment costs $850 US dollars.
Oh, wow.
And then the skincare that they sold, one spray was, I think it was like $150. So it's quite expensive. And then, but the skincare was
a lot.
The skincare was expensive. The treatment was like $850 for all of those things. It's fantastic.
Amazing.
And it was a beautiful facial treatment as well. So the nurse also gave me a facial. It was about 2 hours. Wow. My consultation with the dermatologist, she sat with me for about, I think, 30 minutes. We were just going over skin history, and she was analyzing and showing me and telling me how to take care of my skin afterwards. At the other clinic, I did the Onda for my arms, Picosure for my face and my neck. I had my titanium lifting, which was the skin tightening and face slimming. And then I also had an LDM treatment there as well. And that was also close to $850. It was just under $850, I believe. So it was like where one Picosure treatment here in the US, because everything is so much more expensive for us here for so many different reasons, is around $950 to $1,400. So I got all of those things done. It was fantastic, so affordable.
That's amazing. I'm sold.